I think people
Right.
get really exhausted in this work because of the nature of what it is. And so I think, that can definitely impact outcomes if you don't have a healthy workforce and people who
Absolutely.
know how to manage and mitigate their burnout.
Our special guest for today is Trina Ita, Deputy Executive Commissioner of Behavioral Health Services at Texas Health and Human Services. Welcome, Trina.
Good morning. Good morning. Good morning.
Great. Thank you for taking time out of your busy schedule to participate in this podcast. And we're going to go ahead and get started here. Um, Define what behavioral health continuum of care entails, including prevention, intervention, treatment, and recovery services.
So when I think about the behavioral health continuum, I think about behavioral health services across the lifespan,
Hmm.
the type of services that happen through those different iterations and those developmental stages. And so, when I think about prevention, I think about prevention from the perspective of all the activities and services and supports that might happen for someone
Okay.
before they even get to a space where they may be interfacing with more intensive services. So prevention services can look like building community resiliency, making sure people have access to things like housing and food and transportation, kind of daily life essentials. Because if people have those very fundamental things, I think it improves their trajectory overall. I think about families and children in particular, having a solid, secure family and having that child have all the resources and supports they need for daily living,
Hmm.
I think is part of that prevention work, and making sure those things exist in communities to support, youth and families.
Okay. Okay.
Mhm.
If you can highlight the importance of addressing mental health needs across different age groups and specialized groups.
It's so critical addressing mental health needs, particularly before people get into crisis.
Mhm.
Right? It's so important to identify as early as possible. And that's where I think the DBH program is so on point in terms of looking at an integrated care model, where if somebody's coming in with a primary complaint of physical health, and then you're identifying, if there's a clinician on site, identifying that there are some other factors on the behavioral health side, then they can intervene a little bit earlier with those types of services so
Mhm.
that an individual doesn't go into crisis.
Absolutely, absolutely. And I can definitely see that emphasis in the DBH program as well. Um, our next question, can you discuss how the current behavioral health system faces challenges such as a fragmented care, lack of access, and stigma?
Sure. I
Mhm.
think access has always been a challenge, and I think stigma
Definitely.
does dovetail into that,
Hmm.
right? If people are unwilling to seek help because of the
Hmm.
stigma associated with mental health or substance use issues, then they're not going to penetrate the system. They're not going to go seeking. And so that's how stigma, I think, ties to lack of access. And then I think about workforce challenges, where we don't have as many professionals going into this work because it's challenging work, dealing with
Absolutely.
human issues and challenges and traumas that people have.
Hmm.
Can take its toll on practitioners. And so, it's all of those pieces. And then you think about funding, and funding for these types of services and supports. There's not parity between, say, physical health care and behavioral health care in terms of how the investment of resources. And I think that does stigmatize to that, right? Um, in terms of the amount of resources that have been invested in behavioral health comparatively to physical health care.
Okay. Explore how these challenges affect the ability to deliver value-based care, focusing on outcomes, cost effectiveness, and patient satisfaction.
So, I mean, if you have I guess I'll go back to the workforce piece. If you have a workforce, the workforce that is here,
Hmm.
um, they're tired. I think people
Right.
get really exhausted in this work because of the nature of what it is. And so I think, that can definitely impact outcomes if you don't have a healthy workforce and people who
Absolutely.
know how to manage and mitigate their burnout. That is going to affect the client outcome because you can't be fully present in the experience with the client if you are just if you have your guard up, if you're not fully engaged in the
Right.
process because you're so exhausted from the work itself.
Right.
So I think that definitely impacts outcomes. And then, in terms of cost effectiveness, I think, it's important to focus on things that have evidence, things that demonstrate that you can get outcomes using particular interventions. And that to me taps into the cost effective piece because if you're providing quality services, whether that are evidence informed or evidence based, then you're going to get the better outcomes with the goal of moving hopefully people off of services or out of your care. Now they may have to come back for the occasional tune-up, right? I know we talk about that in the
Right.
DBH program, people having to
Hmm.
come back periodically, which is okay, right? Because there are those things that happen in life where you might have to come back, and just process some things. But yeah, I think evidence-informed, evidence-based to ensure cost effectiveness, which also, if it's evidence-informed and evidence-based, it's going to focus on those outcomes. And that's where you get the value, right? Right, in the services that you're delivering.
Explain how the concept of integrated healthcare, where physical and mental health services are coordinated and delivered collaboratively.
So that in a nutshell is
Mhm.
how I perceive the DBH program, right?
Okay.
Is the focus on integrating the physical health care with the behavioral health aspects,
Mhm.
which are inclusive of mental health and substance use services. So to me, the concept of integrated care is it's holistic care. It's where you see the individual and you focus on their whole health, not just the physical aspect, but the mental health and or substance use issues that might be presenting along with those physical health care conditions, where there's a collaborative partnership amongst all the practitioners that are serving the needs of that individual. So between the physician, and the clinician that's providing the therapeutic services, that they're in constant communication and partnership around what are the best interventions and supports that are needed for the individual to both address their physical needs and their behavioral health needs.
Okay. So can you illustrate the potential benefits of integrated care, such as improved health outcomes, better care coordination, and reduced healthcare costs?
So when I think about the potential benefits of integrated care, such as improved health outcomes, so I'll talk about it based on my experience. And I typically work with populations that are
Hmm.
uninsured or underinsured. And so those folks tend to have challenges, obviously socioeconomic challenges, right? That sometimes might impair their ability to access care. And it can go down to something as granular as transportation and the inability to manage a multitude of appointments with different practitioners. So in an integrated care model where you have kind of this co-location of all the disciplines serving that individual, it helps mitigate the individual's, I guess, financial risk in terms of trying to have the resources to get to multiple appointments in different locations, but also too with their treatment adherence. If they think there's going to be a level of convenience coming to one location for the services and supports that they need, then they're more inclined to participate in services. And then I will talk about it from a population health perspective. Then to me, if you have that kind of as the framework, then more broadly, if people are actively engaged in treatment and services, then you're going to get better health outcomes, and you're going to have a healthier population.
When speaking to the role of digital behavioral health solutions, including telemedicine, mobile apps, and online therapy platforms, can you discuss how these tools can help overcome barriers to access, increase convenience, and provide personalized support?
Absolutely.
Okay.
The advent of telemedicine and telehealth, I think right now, in this point in history for providers and clinicians is critical. Um,
Hmm.
we have, again, as I said, the workforce shortage. And so keeping that in mind, the convenience for both practitioner and the individual receiving services and supports, um, has been really, as I noted, instrumental in continuing care for some folks, particularly when we went through the pandemic. I think that is where we really saw an explosion of the use of those telehealth and telemedicine platforms. There was some utilization prior, but I think that, with something like a pandemic, having that at our
Right.
fingertips was
It
such a great tool,
was a
to
great
ensure that,
tool.
yes, to make sure people
Hmm.
had access to care. And now in the busyness of what our lives are, right? I think people are just so busy, having something like telehealth and telemedicine um, available to them is key, so that you can fit therapy into your busy lives. Because sometimes we put things off, like we put our own self-care off. And so having access to something like behavioral health through telemedicine and telehealth options um, is key for convenience and for, I think, adherence and for
Hmm.
self-care. So yes, telehealth and telemedicine and those digital platforms. Now they have apps where you can just kind of do doctor on demand services,
Hmm.
um, and things of that nature that really meet people where they are in the busyness of their lives. And that is something that is really critical.
Yeah,
I think even for professionals like us, right? Us as practitioners, sometimes we need to engage in these processes.
absolutely.
And, it's we're so busy sometimes,
Yes.
being the caregiver, that we forget to care for ourselves. So having something, a tool like a digital platform or telehealth or telemedicine as an option can be very key for us too.
Yes. And we need
We
it.
absolutely unequivocally need it.
Okay. Can you explain um, why organizations and individuals should support initiatives, pretty much promote and support integrated care and the DBH?
I think it should be promoted and supported for all the reasons that we've talked about today. I mean, it's cost effective, it's person centered, it creates ease and convenience that is a benefit, to managing our busy lives. And then it is, again, I'll go back to kind of from a population health perspective. If there's more integrated health happening where people can go to, I'll use the not, it's not a colloquialism, but kind of the one-stop shop concept,
Yes.
right? Where people can
Mhm.
go to a location and get their healthcare needs met. Um, you know, it, I think you're just going to get better outcomes in the long term. So I
Long
think it's
term.
important. I think integrated care is important, for both the individual receiving the services and for the practitioners delivering the services.
Absolutely. Trina, thank you for taking the time out for us today and answering these questions to our audience. And we look forward to seeing all the amazing work in your new leadership role in the state of Texas. And we're definitely extremely just excited and knowing that you're going to do an outstanding job and make a huge impact in your state.
Thank you so much. Well, I'm excited to be here, and I'm always excited to talk about behavioral health whenever I can. And I'm excited about the DBH program and what that means for the work that I do here in Texas. So thank you so much.
Thank you. Thank you. And to our audience, thank you for joining us today. Please like, share, and subscribe to our podcast. Thank you for coming, and we will see you at our next podcast.